the Social Security Administration, SSA, is remaking itself around a digital identity system that tens of millions of its beneficiaries cannot use, while simultaneously dismantling the in-person safety valve that has long allowed people to navigate the system when digital verification fails. It is a transformation driven by staffing cuts, budget constraints, and operational redesign, and one that raises an urgent question at the core of federal benefits administration. Can the agency legally and operationally require digital and financial authentication, steps that its user base is structurally unable to satisfy, while removing the in-person alternatives that make the program accessible at all? More than 71 million people depend on Social Security benefits each month. The overwhelming majority are older adults, disabled workers, or low-income individuals, precisely the populations that fare worst in credit-based identity systems, digital authentication tools, and online verification workflows. Yet SSA is now shifting its service model so dramatically that digital access isn't merely an option. It is becoming, through policy and attrition, the primary gateway into the system. Internal planning documents obtained by NextGov/FCW show the agency intends to cut field office visits by half, from 31 million per year to no more than 15 million beginning in fiscal year 2026. SSA Commissioner Frank Bisignano calls the shift modernization, but the structural forces behind the move tell a more sobering story. After Donald Trump returned to office, the White House directed SSA to reduce its workforce by roughly 7,000 positions, the largest single staffing contraction in the agency's modern history. Field offices lost nearly 2,000 employees. Another 1,000 were reassigned to the national phone line. Congress has, to date, passed no legislation restoring staffing for FY 2026 or beyond. For an agency already strained by a decade of attrition, the result has been predictable: shrinking in-person capacity, longer waits, and mounting pressure to push the public toward digital services whether they can use them or not.